Thank you for this opportunity to speak at the third AI for Information Accessibility Conference. My name is Soyoung Kim. As the director of the Korea Policy Center for the Fourth Industrial Revolution, I'd like to share the experience of creating a guide for professionals and citizens alike to use when they make healthcare decisions. Before getting to the main presentation, let me briefly introduce my center, which is created in 2019 out of the collaboration between the South Korean government and the World Economic Forum in order to monitor and develop policies and governance frameworks for the fourth industrial revolution technologies such as AI, blockchain, VR, AR, precision medicine, etc. Over the last 3 years, we have produced a number of reports on major regulatory issues for the latest emerging technologies, including the issue briefs published on the World Economic Forum platform. These World Economic Forum articles have focused on two issues, education and healthcare, as these are the most heavily affected areas with the non-contact online deliveries of services during the COVID-19 crisis. The experience I set to share is this report, finalized last year. It was the product of the year-long collaboration of three organizations: Institute for Public Understanding of Risk of National University of Singapore, Sense About Science of the UK, which is a science-based NGO working on science communication and culture, and my center. AI is utilized virtually every domain these days, yet it has seen dramatic growth in the healthcare sector, as seen in these graphs, in terms of the market size and also the number of patents. Plus, numerous tech ventures and startups are operating in various areas of healthcare industries, such as personalized genetics, disease monitoring, and drug discovery. More specifically, AI is used to support clinical applications such as robot surgery, patient decisions such as lifestyle applications like fitness trackers, healthcare administrations, and therapeutics development such as drug repurposing. So the key questions to develop this guide is the fact that healthcare is the domain with the fastest AI applications, while being one of the most professional and technical domains. There are also other considerations. First of all, in healthcare, there's intensive interaction of experts such as health professionals and lay citizens like patients and their families. Plus, there are very strong, frequently colliding interests of multiple stakeholders. As is the case with most countries, healthcare is also the most heavily regulated area due to ethical, legal, and social risks. So it's very vital that people know what to ask and what to check when they come across the AI applications in healthcare. What if policymakers, healthcare agencies don't know what to ask about a new AI application? What if they pass on flawed information? Who is accountable when things go wrong? For instance, in the area of diagnosis, AI applications may face issues like liability and privacy data protection. And also in the area of monitoring, AI applications, when based on biased data, can cause very serious risks. Therefore, we have come up with a guide to help various people to make decisions when using healthcare-related AI. The target audience for this guide includes not just policymakers or professionals, but also journalists and lay citizens like patients. Our AI guide for healthcare is structured as in this slide, from the introduction of key terms to a vision for a reliable future for AI. Let me concentrate on the main part in the rest of the presentation, which is questions to ask about AI in healthcare. Our questions are grouped into three. The first group of questions is what data AI is based on. This is important because AI is essentially data technology. As such, how the data used to train AI is collected is critical for representativeness of AI recommendations. For instance, if a skin diagnostic AI is trained and validated using images collected from fair-skinned people, there's a risk that skin lesions on darker-skinned people are more likely to be missed or misdiagnosed. The second group of questions is about the assumptions AI is making for patients and diseases. In particular, since AI is data-driven application, it is often the case that correlation gets to be confused with causation. Also, whether the results can be generalizable, whether the variables excluded from the model to construct an AI algorithm are really irrelevant, and also whether AI can really eliminate human prejudices. All these are very important questions to check on. Finally, how much decision weight can you put on AI? That is, how can we assess the performance of AI? Do we have tools to properly scrutinize the reliability of AI applications? For that purpose, we may use independent data sets to test how good AI application is when making a prediction for new data. Well, I believe this 24-page guide, relatively short, but it took a full year. Anyway, this 24-page guide is only the beginning, for we need more such guides in other domains. This guide offers a starting point of discussion on reliability and accuracy of AI-based healthcare decisions. Yet, there are a number of challenges in the work like this. Most of all, I guess the biggest challenge is actually to turn expert knowledge and insights into common languages, something that lay citizens can easily understand. I hope this guide can be used as an example for both developers and also users of AI applications in other domains as well, in order to ensure the right kind of AI be developed and utilized for a reliable future. Thank you very much.